And our recording is going. Good afternoon, everyone. Thank you for joining us. We will pause for just a few moments to get everyone logged on. We will begin in just a moment once we get everyone logged on to the call. We do have interpretation this afternoon. Ms. Yeager, if you would like to introduce yourself quickly.
Thank you, Dr. Kaiser. I'm Emilia Yago, interpreter for the county, and I would be interpreting for this session. If anyone needs Spanish interpretation, they can look on their screens. There's a little world thing there that they can go to and choose Spanish. Bienvenidos a todos. Soy Emilia Yago, intérprete para el condado de Albemarle, y voy a interpretar esta sesión. Si usted necesita interpretación en español, puede ver el mundo abajo de la pantalla y puede ir allí, elegir español, y vamos a ir a la sala de español y van a escuchar toda la interpretación en español allí. Muchas gracias. Thank you.
All right, thank you.
And good afternoon, everybody. So this is our May school community information session. And today we're going to be focusing on school and community health. And we have an amazing group of panelists, both in the medical field and also in our school system as well. So we bring you these community information sessions as a way to connect with our families, provide the information that you all are asking for. And again, this presentation will be recorded and it will be posted on our YouTube channel. We will send that out to our entire community. So I do want to welcome everyone that was able to make it today live. With that, I'm going to pass it over to the Assistant Superintendent of Community Engagement, Dr. Daphne Kaiser.
Good afternoon, everyone, and welcome to the community information session focused on school and community health. Hosted by the Office of Community Engagement. Again, thank you, Dr. Irizarry. I'm Daphne Kaiser, Assistant Superintendent for School Community Engagement, and your moderator for this event. During this afternoon session, we will have community partners and division leaders who will provide important information for students and families to help them navigate school and stay healthy. Our goals for this session include first, informing the community about the local opioid crisis, sharing information about how the opioid crisis is affecting our area and what families need to know to stay safe. Also, we will be providing information regarding Narcan resources and making families aware of the support available to help deal with opioids, including how to obtain and use Narcan. Second, we will talk about the importance of vaccines and discuss which vaccines are needed to attend school in ACPS and why they are key to keeping students healthy and ready to learn. Keeping our students and their families safe and healthy is important to us and important for our school communities. In addition, participants on the call will have an opportunity to ask questions at the end of the presentation part of the session. Dr. Irizarry gave us our welcome this afternoon. I will provide an introduction of our panelists momentarily, and the panelists will also participate in the question and answer part of the session. We'll hear from our panelists. They will have presentations, and then we will have our question and answer session. And then Dr. Irizarry, Director of Equity, School, Family, and Community Relations, who you just heard from, will close out our time together with final thoughts and next steps. So we appreciate your time to be with us. We really have a great group of panelists joining us this morning. Our presenters will share about 10 minutes worth of information related to their diverse roles pertaining to school and community health. So in a moment, I will introduce the panelists in order in which they will present. But before I do that, I did want to mention we do have Spanish interpretation. Mrs. Yeager will be the interpreter for the session. So if that is important or necessary for anyone on the call, please do take advantage of this. We will also be recording this session, and information will be posted on our ACPS YouTube channel. You will have access to this for as long as you need to, and we will be sending it out to our community so that everyone will have an opportunity to watch, even if they were not able to attend this afternoon. So at this time, I'm going to give Mrs. Yeager an opportunity to introduce herself and to speak with our audience. And then Mrs. Yeager will meet participants in our interpretation room.
Thank you, Dr. Kaiser. Gracias, doctora Kaiser. Otra vez soy Emilia Yeager, intérprete para el condado, y para español, por favor, si usted quiere elegir español, tiene el mundo en su pantalla y puede ir allí, y vamos a ir a la sala de español para escuchar toda la presentación en español. Thank you so much. If you need Spanish interpretation, please go to the Spanish room. You can see a little world icon on your screen, and I'll be there in the Spanish room with you. Thank you so much.
All right. Thank you, Mrs. Yeager. All right. Feel free to put your questions in the Q&A function at the bottom of the Zoom. We will not answer them until after the presenters have had their 10 minutes to speak. We will take about 30 minutes at the end of the session after our panelists have presented to answer questions. At this time, I would like to introduce our panelists. We are so glad to have our community partners join us for this event. We have Dr. Dania Chastain, Associate Professor of Clinical Anesthesiology, Director, Office of Pain Management and Opioid Stewardship from the University of Virginia Department of Anesthesiology, Division of Pain Medicine. Ms. Ann Kroonquist, Parent Advocate for educating students and families about the dangers of fentanyl and One Pill Can Kill. Ms. Hope Perez, Immunization Specialist, Blue Ridge Health District. Ms. Eileen Gomez, Coordinator of Nursing and Health Services, Albemarle County Public Schools. And Mr. Kevin Kearse, Executive Director of Student Services, Albemarle County Public Schools. All of our work and everything we do in ACPS is centered around our strategic plan, Learning for All. Our vision: learners are engaged in authentic, challenging, and relevant learning experiences, becoming lifelong contributors and leaders in our dynamic and diverse society. Our mission: working together as a team, we will end the predictive value of race, gender, and special capacities for our children's success through high-quality teaching and learning for all. We seek to build relationships with families and communities to ensure that every student succeeds, and we will know every student. Our values include equity, excellence, family and community, and wellness. Our goals: thriving students, affirming and empowering communities, and equitable and transformative resources. Although our session this afternoon touches on all three goals, the primary focus will be around Goal 1 and Goal 2, thriving students and affirming and empowering communities. Now I'm going to turn it over to our panelists, and we will come back in a short while to answer questions afterwards. Dr. Dania Chastain, Associate Professor of Clinical Anesthesiology, Director, Office of Pain Management and Opioid Stewardship, University of Virginia Department of Anesthesiology and Division of Pain Medicine. You are first to present.
Well, thank you, Dr. Kaiser, and thanks to you and the organizers for providing the forum that we can talk about, this most important topic. So good afternoon, everybody. And as she said, I'm Dr. Dania Chastain. Come from UVA Department of Anesthesiology. I'm trained as a clinical psychologist. And so it's a little bit different than you might expect coming from an anesthesiology department. But our pain management program is nestled into the Department of Anesthesiology, and I've been there for quite a while and have enjoyed seeing pain patients over the years. Next slide. But we started something different. I'm the founding director of the UVA Office of Pain Management and Opioid Stewardship. And what this is, we saw that there really wasn't a central location where you could go to find information about the opioid crisis, because it really has changed the way that we assess and we treat pain. And so we wanted to come together to do that. So we have an advisory board with 40+ folks. We're interdisciplinary with social workers, physicians, nurses, it's any discipline that you could think of. And our main goal is educating. And we have educational programs for patients, for families, and for the community in general, along with healthcare providers. And with our community involvement, we've been going into the schools, the public and private schools. And what we're interested in is providing needed education so that the kids and their parents can understand the dangers that are out there within the opioid crisis and how everyone can make the best possible decisions based on fact to be safe and healthy. Next. And before we get started, I always like to give a little disclaimer. Opioids are not evil here. There is a much needed place for opioids in managing people's pain. What we're talking about today is misuse of those substances. But we've also seen that there have been some patients suffering in pain who, because of the message that's out there and the stigma, have been reluctant to have their pain appropriately and effectively managed. But if you work with a provider that's trained, you can use medication safely and effectively. So I wanted to make sure that that was out there to start with. Next. And as we go along, you may not think it has, or maybe it has. We all have our stories to tell. So just think about, how has the opioid crisis affected you? Next. The one thing about it is it knows no boundaries. As you can see, the statistics here nationwide, in Virginia and in Charlottesville, the opioid crisis, it's an equal opportunity offender. It doesn't matter what gender, race, political views, whatever you are, nobody's immune to it. Next. And in our backyard, you can see since 2017, opioid overdose, drug overdoses have been the leading cause of death in Virginia. And since 2020, more Virginians have died every year from overdoses than if you put car accidents and gun violence put together. And they're nearly doubled the deaths since 2016. Next. There was an incident, they've been all over, but just to go a little closer to home, there was an instance of a student up in Culpeper who was given, she thought she was taking Adderall, and it turned to be laced with fentanyl. Next. And up in Loudoun County in October, they had 8 overdoses within the month of October. Next. And this brought about Governor Youngkin. He wrote an executive order on student education to prevent overdoses. And if you look at number 3 on the second page there, it says to provide information to schools based on decision-making. And this is really what we're trying to do, to educate our kids to make the best decisions possible. Next. You'll be hearing about this today from our next speaker too. The DEA administrator, Ann Milgram, said, it's not a war on drugs, it's a fight to save our kids' lives. And often what we've seen, there have been deaths by taking one single pill. And so this one pill can kill initiative has been out there. And like I said, our next speaker is going to talk more about that later. Next. What we do with our educational programs when we go into schools, and we usually do so far we've done the parents and the students separate. We start by talking about the demographics, like where are we? How did we get to this place? We define some of the terms that are used are often used incorrectly. We talk about the impact that fentanyl, xylazine, MDMA, counterfeit pills have had on our young people. We discuss warning signs. How can you take care of yourself and those that you love who are around you? We know there are psychosocial factors that contribute, but also protect from these risk factors too. We want to make sure they understand the signs of what overdose looks like. We teach how to use Narcan and other type of harm reduction strategies. And that includes medication safety, how to store medication, the responsibility it is to have these opioids, and appropriate disposal when you are finished with them. Next, please. Looking at the demographics, as I said before, it knows no boundaries. Typically, we're seeing more girls than boys, but it affects all races and genders. Next, please. And it's important to know the definitions when we talk about it. So today, what I'm trying to do is provide like a brief nutshell of what we talk about in our program. It's important to know the difference between tolerance, physical dependence, and addiction. These terms get used interchangeably, and they're really very different from one another. If I could see your hands raised, I'd ask, how many people drink a cup of coffee every morning, or 2 cups or 3 cups, and then one day you're running late, you run out the door and you don't get your coffee. Well, a couple hours later, you're going to start to feel pretty crummy. Okay, does that mean you're addicted to coffee? What that's called is physical dependence, and it's normal. There are certain substances that we take that when they're in the body regularly, and then all of a sudden you take them away, you will have withdrawal symptoms. So that's just a natural effect that happens to everybody. Tolerance is when the substance you are taking isn't giving you the desired effect anymore. And instead of 2, you need to take 3, 4, and you're building up that tolerance. And addiction is about behaviors. It's even though there are consequences to it, and those could be, not fulfilling your role at work or at home, or not being able to study, or just take place of your roles, that you seek the drugs out at great consequences, and you have difficulty stopping. You're not able to stop on your own. Next, please. And so we look at potential exposures for adolescents. Where do they come across them? Often the first place that teenagers might encounter opioids is with wisdom teeth extraction. I'm sure many of you have gone through that with yourself and your kids, and often they are given some narcotics after that surgery. We've also seen it with sports injuries, accidents, post-op, and also dealing with some mental health issues. Often people will try to self-medicate for some mental health issues. Next. So where do teens get these? Where are they getting these opioids? The number one place is the family medicine cabinet. I mean, we all have, medicines you don't finish using or whatever, and you kind of just stick them back in there. On Saturday, we took place in one of the drug recall days, and we collected 165 pounds of pills on Saturday. So we all have them. We're seeing kids get them from the internet, pharma parties, dealers, as well as on social media, and of course from their medical healthcare providers. Next. And the reason we talk about fentanyl is fentanyl has been deadly. And it's 100 times more potent than morphine. 50 times more potent than heroin. Fentanyl is unforgiving. Next, please. And with the doses, you could see age 14 to 18, the overdose deaths increased 114% from 2019 to 2021. And the vast majority of those did involve fentanyl. And more than 25 were associated with counterfeit pills, which we'll talk about. Next, please. And this is what it comes down to. The white powder is a lethal dose of fentanyl. That's all it takes. Next, please. And what we're seeing is dealers making counterfeit pills. And as you can see on these slides, you cannot tell the difference. No kid is out there or adult is out there looking for pills laced with fentanyl. They think they're getting Adderall to study for a test, or, Xanax to calm some nerves, or maybe oxycodone for, either recreational or pain reasons. You cannot tell the difference with them. Next. Marijuana, the impact of that has been controversial, especially since more and more people are using marijuana. There have been some reports of some cross-contamination too. So for example, if a dealer had put some fentanyl in a bag and then uses that bag to put pot in and sells it, as you just saw on that picture with the penny, it just takes a tiny bit. Next, please. And Molly it's also called ecstasy, has made a big comeback. It was a big party, club drug in the 80s. And now we're finding it back and it's being laced with fentanyl too. Next. A new thing that has come on the horizon, and the DEA and the White House stepped right up to it, is this it's called xylazine. And what it was made for, it's a large animal tranquilizer. It's not an opioid, but it's been mixed with fentanyl and has caused just deaths. They call it the zombie drug online, or trank. And it causes these horrid ulcerations that look like a zombie. And it can lead to the need for amputations too. Next. And while we're talking about all these different types of drugs, it's important to know that our adolescent brain, our kids' brains are different. They're not the same as ours because the myelin in their brain has not yet fully developed. And so in order to compensate from that, the nerves and the signals that get sent have to be stronger and louder to do that. And since they're sending those jarring signals, a lot of teens experience both positive and innate and negative emotions with greater intensity than we do as adults. And because of the way these neural pathways are formed, the adolescent brain tends to get addictive habits happen more quickly. Next, please. And as far as the prescription opioid abuse in teens, you can see males and females, and we're also seeing higher rates in the LGBTQ+ community. We know that there are risk factors, and some of the risk factors include if there's a family history of substance abuse, there can be a genetic component. If parents allow or have they call it a favorable attitude towards their kids using drugs, or they're not being monitored. Also, family rejection, especially associated with sexual orientation or gender identity. And if the peers are using, it's more likely that they're all going to be using. Next, please. And protective factors, what can help prevent the kids from going this addiction path? Parent and family engagement, is key, as well as school connectedness. You know, that gives you a foundation, and the research is showing that, you know, with the peers and family are the most, and then followed by school connectedness and also neighborhood, you know, having those connections. Next, please. Warning signs to look for. You want to look for changes. You know your kids. So if their moods start changing, someone who used to be a great student isn't turning in homework, they're just kind of not interested in anything, take note and trust yourself. Trust your feelings, your gut. Next, please. And our teens are dealing with things that we never thought of when we were growing up. And, you know, the amount of depression, anxiety is so high with those. And 1 in 5 kids have major depressive episode this past year. And more than half of them don't receive any assistance. And self-medicating, again, is often a way that kids deal with that. Next, please. Other signs of substance abuse, you notice that they're not maintaining eye contact anymore. Maybe money's disappearing. They're going behind locked doors. You know, teens that used to bring their friends around to the house, they don't want their parents to know who they're hanging around with, or they change friends group. All of those things are things to look at. Next, please. And again, we talked about this, that parents and peers have the strongest effect. Next, please. But we can save lives with this. And this is what we tell the kids: to notice the signs, to be involved. 2/3 of teens who overdosed had a bystander present. You know, but most of them didn't have a response. So we teach them, what can they do? Next. And we're fortunate, we have very good Good Samaritan laws in Virginia, and we let the kids, some kids are afraid to call 911, that they're going to get in trouble, especially if there's drug paraphernalia there, if there's drugs, you know, on there. And our Good Samaritan laws, if you call, you give your name, you stay there until the first responders get there. Even if you're on probation, you are not going to get in any legal trouble. Next. So the harm reduction does save lives through education, Narcan training. Like I said, we do that with all of our programs. We talk some about fentanyl test strips. If they have some medicine they want to touch, you can dip it, just like we've all done for COVID. You can get those. Having effective and appropriate pain management and safe ways to dispose of medication and safe ways to store them. Next. And just remember that accessibility is the main thing. If they can find them in a you know, medicine cabinet, whatever, it's important to get those out of there. Because every day 1,000 American kids misuse prescription opioids. Next. And it's important to know too that 80% of opioids or overdose death occur inside a home. Next, please. And to keep your prescription safety at home, we have brochures that talk about this too, what you could do. Lock it away. If your kids are getting ready to go to college and they take Adderall or other medications, we encourage use of lock boxes, you know, and those type of things. And use the drop boxes around town to get rid of medicine that's not being used, so it doesn't wind up on the streets. Next, please. And same with the leftover prescription medications. And you can even make a disposal bag yourself if you don't want to go to a box. You can mix the pills with coffee grounds, cat litter, dirt, put them in a well-sealed container and put them in the trash, because we don't want anybody, you know, flushing them or putting them back out into the system. Next. And when you talk with your teams about opioids, just remember that opioids are, especially fentanyl, are unforgiving. We want to focus on reality, not the judgment. Be clear about the risks, remind them to look out for each other. And I think all of us too need to show compassion because the teens now are so vulnerable with the stressors that they're facing. Next. And I will leave it there and we can talk about questions or thoughts at the end.
All right, thank you so much, Dr. Chastain, for that important information. Next up, we have Ms. Ann Kroonquist, parent advocate for educating students and families about the dangers of fentanyl. And as you heard from Dr. Chastain, the one pill can kill. She's going to talk a little bit more about that. Ms. Kroonquist, welcome and thank you.
Thank you so much for having me today. My name is Ann Kroonquist. I've been an Albemarle County resident for 13 years. I am a mom of 4 graduates from Albemarle High School. I was also the school nurse over at Lakeside Middle School, formerly known as Sutherland, for 7 years. And now I work at UVA as a registered nurse in their physical medicine and rehab ambulatory clinic. I love this community. And even though my children have all graduated, I continue to be invested in our students and in keeping them safe. That is why I'm here today to talk to you about the fentanyl-tainted street drugs, also known as fentanyls, that are being found in our community and how we can start to educate our children on the subject. I know that these are hard discussions to have. I also know that where our children are concerned, there just seems to be one difficult discussion after another with them. But as we know, these difficult discussions are also the most important ones to have. They have to start somewhere, so I figured, why not with me? You see, the subject hits very close to home for me. On June 23rd, 2022, I lost my 23-year-old son, Kevin, to a fentanyl-tainted street drug. He had purchased this pill right here in Albemarle County from a young man who was also 23 years old at the time and lived in Charlottesville. This young man's contact information was given to Kevin from a friend of a friend of a friend, and Kevin was able to contact him through Snapchat, pay him through Cash App, and meet him right over by Chick-fil-A. And that afternoon, after taking just one pill, Kevin was gone forever. That one pill had enough fentanyl in it to kill an elephant. So as difficult as it may be for me to tell this story, I know how important it is to get this information out there. I promised myself that Kevin's death would not be in vain. So today I come to you to talk about an educational program that will address this crisis that we are experiencing and basically just get this information out to our children. Although I am so thankful to Ms. Gomez that she's taken the initiative and everyone else to educate our educators and parents on the importance of how to use Narcan in an emergency overdose situation, I feel that it is even more important to educate our children of these dangers that are out there and possibly stop these overdoses before they even happen. You may or may not be shocked to hear that the infiltration of these fentanyls is well known among medical and law enforcement authorities in our community, but not by the most vulnerable group, our young people between the ages of 13 and 24. I am dedicated to raising awareness about these fentanyls or fake pills made of fentanyl. I feel as if the best way to address this problem that we are facing is to specifically warn our children of the prevalence of these fake pills. I personally have taken on this assignment and am looking forward to working with Dr. Chastain in educating our community in the future. I would like to share a short video with you that has been put together by a group called Song for Charlie. Their main goal, like ours, is to educate our children. And this short video kind of sums it up. And again, it's aimed towards our children. If we could play that video, that would be great.
Pills killing young people, right? A teenager takes what they thought was a prescription pill and never wakes up. We're not talking about a drug overdose, accidental or otherwise. We're talking about being fatally poisoned by a single pill, one that looks like a legit Xanax or Percocet or Oxycontin. Except these pills aren't legit. They're counterfeit, fake. They can kill you within minutes. And it's happening all around you. This growing group of victims is young and inexperienced. They take pills for different reasons. Some of them are experimenting, others are stressed out and self-medicating. Many victims died at home in their beds after swallowing just one pill. Every young person is at risk. So what's going on? We live in a quick fix, pill popping culture, and we've been taught to trust prescription pills. In some cases, these medications are necessary, but they can also cause addiction. That's why we're in the midst of an opioid epidemic. So many people in the US became addicted to opioids that drug dealers started making fake pills to meet demand. The active ingredient of choice for these counterfeit pills? Fentanyl, a powerful synthetic opioid that's so potent it has to be highly regulated. There's no standard amount of fentanyl in these illegally made pills. They're not prescription medications. They're just thrown together in people's basements and garages with other cheap ingredients like filler powder and pressed into pill form. The dosage is never even. That's why they're so deadly. But fentanyl can be cheaply imported, and it's also highly addictive, which makes it ideal for creating fake pills. The drug cartels got involved too. They started to produce these counterfeit prescription pills containing fentanyl, known as fentanyls, on a massive scale, flooding the US with millions of fakes dressed up to look like the real thing. You can't tell them apart. Authorities can't fix this or make it go away, but you don't have to be the next victim. If you don't know where your pills are coming from, don't take them. Don't believe sellers on Instagram, Snapchat, TikTok, or any app. Don't believe friends who get pills from supposedly reliable dealers. Don't believe someone who says a pill has been tested. You may have heard of test strips that can detect fentanyl in illegally made drugs, but they're not reliable with pills, where fentanyl can be unevenly distributed. There's no way to figure out whether a pill contains fentanyl without grinding it up and dissolving it. In other words, destroying it. So if a drug comes to you in pill form, it hasn't been tested, period. And even if you test one pill in a batch, you have no way of knowing whether the other pills contain fentanyl. If it's not from a doctor or pharmacist, it's not legit. No random pills. Now you know the facts. Tell your friends, tell everyone you know. The more people who learn about fentanyls, the safer we're all going to be. You didn't create this problem, but you can be part of the solution. Help us spread the word. One pill can kill.
Once again, thank you so much for including me in on this meeting. And I'm hoping to try and stay around for any questions at the end. Thank you.
Thank you so much, Ms. Hornquist. Now, we're on to Ms. Hope Perez, immunization specialist from the Blue Ridge Health District.
Hi, thank you very much for having me. I am Hope Peretz, and I am the lead immunization nurse for the Blue Ridge Health District. As you all in school are preparing to finish your year, we're getting into high gear, thinking about back to school immunizations. It's never too early, People wonder why we need to have all of these immunizations these days, and they think about these vaccines as being, kind of from a bygone era. But the truth is that all of these diseases of old are now making comebacks. And there's a lot of reasons for that, but probably the biggest is that travel is so easy now, and different parts of the world vaccinate differently. That's something we see every day here. Is we get records from people all over the world, and different countries. They may give the same vaccines as us, they may not, and they may do them on different schedules. And it's so easy for people to travel now that if they're unprotected, they can go to a country where the rates of certain diseases are higher, and bring that back home. I've got some examples in my next slide of things that are emerging throughout. First, and you may have heard of this, is measles. Measles is increasing globally and nationwide. We have had several outbreaks. We have, in this year alone, we've had double the number of cases through the middle of April as compared to all of last year. So it is really taking off. Part of the reason is because measles is extremely contagious. If you think about, our recent experience with COVID, one person having COVID would infect 2 to 4 people. With measles, one person is likely to infect anywhere from 9 to 16 people that are not protected by a vaccine or acquired immunity. The doses for measles needs to be 2 doses because of its high contagion. One dose gives you about 85% protection, but for a disease this contagious, that's not enough. You need to have the second dose at least a month apart from the first one, and that will take you to a 97% immunity rate, which is protective. Meningitis, which is a vaccine that we give for our rising 7th graders and 12th graders. We are currently in a meningitis outbreak in the state of Virginia. It's been going on since July of 2022. We've had at least 36 people infected, and from that had 7 deaths. Most people who get meningitis, if they do recover, they live with lifelong neurological disabilities. So it is definitely a very, very serious disease that we need to, and we have an excellent vaccine for it. So we, and it's school required. So that's why that one is there as well. Can I have the next slide, please? Pertussis, whooping cough. Now, we do have several outbreaks of these every year in Virginia, and it is most deadly in children and infants because it takes a while for them to develop their immunity to it. It is a series vaccine. It takes 4 to 5 doses for immunity to be established. And then as adults, you should get a vaccine every 10 years to continue your personal immunity. And this becomes an issue when older people have grandchildren. If they don't keep up on their pertussis vaccines, they can carry the disease and it won't look as serious for them. They may not even know that they have pertussis, but they can pass it on to children who are unprotected. It is a disease that creates pneumonia and can be, result in prolonged hospitalizations. It's often called the 100-day cough because it does take quite a while to go away. And in that way, it's extremely important for it to be a school-required vaccine. If you think about getting pertussis, your child's going to be out of school for quite a while. You may not be able to be at work for quite a while if you need to care for your child. And my last example is human papillomavirus, or HPV vaccine. Human papillomavirus causes several types of head, neck, throat, cervical, and reproductive cancers in both males and females. We are seeing great uptake of this vaccine. I think partially because it's being advertised on television, and those advertisements are very effective in raising the awareness of how often that virus causes these cancers. And with that increase in vaccination, we're seeing a sharp decrease in HPV-related cancers over the last 10 years. So that's the good news there. The vaccines are recommended from age 9 to age 26 and up to age 45 for adults that have certain risk factors. Vaccinating early with human papillomavirus vaccine is very important. The earlier you give the vaccine before a child has had the chance to be infected, because this is a very common virus, the more likely that the vaccine is to provide the protection that it needs to provide. So you can get vaccinated as early as 9. In Virginia, it is a required vaccine and we give it at age 11. The shots at that age are 2 months apart. If a child starts the vaccine a little bit later, it is still effective. However, 3 shots are needed, and the cutoff point is if they start at 15. So it'll be a slightly different vaccine schedule if they start a little bit later. Next slide. I'm not sure I have another one. Okay. I'm going to turn this over to Eileen now, and she's going to talk a little bit about our grade level immunizations.
Thank you, Hope. Hope and the Blue Ridge Health District have been very strong partners with Albemarle County Public Schools as we enforce the required grade level immunizations. So these requirements are in the Code of Virginia as well as Albemarle School Board policy for students to be able to attend school. Next slide, please. As I just mentioned, there are certain grade level immunizations that are required for all students in order to be able to attend school. Next slide. This year coming up, the school year 2024-25, students will not be permitted to start school until they have all of the required immunizations for which they are eligible. Next slide, please. So there's a different requirements based on the level of grades to the school. For elementary schools, all incoming kindergarten students and students who are entering primary school for the first time are required to have the complete series of the following vaccines. And the first is diphtheria, tetanus, and pertussis, or various different formulations depending on the dosing and the age of the student. Polio, MMR, which is measles, mumps, and rubella, hepatitis B, hepatitis A, and varicella, or chickenpox. Please note that a copy of a comprehensive physical exam is also required prior to entry into pre-K, kindergarten, and primary school for the first time, and the date of that physical exam has to be within 12 months prior to entering school. Next slide, please. We also have requirements that are specific to the to higher grade levels, including prior to entry into 7th grade, students are required to have 1 dose of Tdap, which is tetanus, diphtheria, and pertussis, but it's a different formulation than the one that was required for elementary school, as well as 1 dose of the Menactra, or MENACWY, and that's the meningitis vaccine that Hope had mentioned, and 2 doses of the HPV vaccine. Now, please note that parents may opt out of the HPV vaccine at their sole discretion and are not required to provide documentation for that. And then prior to entry into 12th grade, students are required to have another dose of the Menactra, or meningitis vaccine. Students who enter Albemarle County Public Schools in any of the grade levels are required to have all of the vaccines that are required up until that grade level. So a student who enters in 6th grade is required to have all the vaccines that were required when entering into primary school. And those who are entering into ninth grade are required to have all the ones that are required for elementary school and middle school when they enter into high school. Next slide, please. All right, well, we want parents to understand that incoming students may not be completely registered and start school until all of the registration requirements have been provided. And that includes the immunization records and a copy of a physical exam for elementary school. Students without all of their required immunizations will not be able to start school on the first day this year until the school gets the documentation that the student has received all the immunizations for which they are eligible. And that concludes my discussion on the requirements. And I can turn it over to Mr. Kirst, who will also talk about the requirements and the consequences for not meeting these requirements.
Yeah, hey, thank you. I'm Kevin Kirst, Executive Director of Student Services, and I get involved with the schools and with families and parents and kids when there's a safety issue. That could be discipline, mental health, or a physical health. And thank you, Hope and Eileen. You are so supportive and kind, but I think what my job is I'm the underline. I'm going to underline a few words of the presentation, and that was required, right? That this is a mandate. This isn't like a local thing. Hey, we're just trying to be safe and healthy. This is the Code of Virginia. It's the law of the land. And Albemarle County Public Schools is prepared to fully enforce that. So we're looking at a partnership with families in the community, and that's why we're here together. But so my job is to emphasize that underline, and it's required. These different immunizations, even the physicals, right, as Eileen Gomez has reviewed, are required for students to participate. So what can happen? Again, I'm just going to underline, boldface, and put an italics on this. That students, it may even be like, oh yeah, I submitted everything. But if immunizations are not complete, your child will not be able to attend school. Now, there are a few, very few exceptions. But I would like the takeaway to be, your child will likely not be able to attend. So the time to address this is now. Hope mentioned. It's not in August or July. It's right now. Now is the time. And I do have a child still in Albemarle County Public Schools, and I got the email already. She's in high school, and it was, hey, you got to take care of this immunization. It's required. And making that appointment. So that is my role today, to stress and underline for the community. And we are going to be doing this at a personal level with families. Hey, records indicate your child's immunizations aren't up to date or are coming due. But as part of our presentation today, we are taking it very seriously. We want to avoid any type of public health crisis. As Hope mentioned, there have been illnesses that have been eradicated that we're now seeing come back, that we could control, we could do things about as a community. So that is my message. And our message to families, also for the larger community, to know we are going to temper this is a have to, it's a mandate. It's not anything political or any type of perspective like that. It's, hey, we're just following the Code of Virginia. And included in the Code of Virginia is students will not be admitted to attend school until their immunizations are up to date. So, but we're going to temper that mandate with supports, reminders. Hey, talk with if you have a physician, give them a call, see what you need, or public health opportunities. Through health department or other organizations. We're going to push those supports out. So I just want to know, this is not just a mandate and we're going to enforce. It's with support as well. We want everyone to start school on the first day. Kids all get excited about that. First day of school is really important that we're all prepared. So that is my message, just as the emphasis and underline of all of those words we heard in the presentation of required, mandated, or not allowed to attend until that's completed is very serious and will happen in those cases. Daphne?
All right, thank you so much, Kevin. And thank you so much to our community partners and division leaders for your presentation this afternoon. You've been incredibly informative and provided the community with some valuable information. And we will definitely heed the information, Mr. Kurz, and we'll take some action to get things squared away regarding our immunizations. We're going to take about 30 minutes at this time to answer questions. We have a few come in through the Q&A function at the bottom of the Zoom, and feel free to keep sending those through, and we will answer in the order that we are receiving these. However, do feel free to email the superintendent's office at k12albemarle.org email address if you feel you have further questions or did not get an answer due to the lack of time. So our first question. Let's see, we have a number. Let's see, does ACPS make vaccination recommendations for its international travel projects to regions where viral infection rates and risk are different from the US?
Well, ACPS doesn't by themselves make those accommodations, but we refer that to the health department, or in some cases to the students' individual physicians. Hope, is there a international immunization?
We do. Yes, we do have one international travel clinic a month, and we are most of those vaccines we are able to give at other times as well if children or adults or anybody comes in. And we go by the CDC guidance. We look at what is endemic in an area, what is circulating. We look at the health profile of the client and what they may be at most risk for, and then make recommendations. And we do give those vaccines as well. Yes.
Thank you.
All right, our next question. Is the vaccine schedule based on age? My 7th grader will start at age 11 and isn't due for those vaccines until they turn 12 and get a later physical.
Well, I think you're talking about the student being currently in 6th grade, but a rising 7th grader, and that the student isn't eligible for the vaccines until their annual 12-year-old physical, if I understand the question correctly. Well, I think that they can make an immunization appointment with their physician, so they're not there for the physical exam, but prior to the physical exam to get those required immunizations. And then there are also opportunities to get the immunizations at the health department, and I believe at some of the local pharmacies as well.
Mm-hmm. That is true. The one thing the pharmacies are a great option for children that have insurance. They don't vaccinate children that aren't insured, so that's not greatest option for those families. The thing to remember, however, is that typically in the midsummer and definitely in August, we see that the pharmacies cannot get enough supply to meet the demand. This is very common, especially with the meningitis. Even though we've been giving it to students for several years now, it can be difficult to get enough supply because it is given for both 7th grade and 12th grade. And so lots of kids need it. And, I'm not sure if it's related to the supply chain issues that we have since the pandemic, or if it's just kind of always been this way, but we do see that there tend to be shortages. So you want to try to get your appointments early. Try to come to one of our clinics. We have a couple of dedicated clinics for Albemarle County schools, and a walk-in clinic at the end of this month, to try to make it as easy as possible. But trying to get your vaccines early is really the best way to go. You avoid shortages and disappointment and not being able to start school.
And we will send out with our next round of reminders, the clinic dates and the contact numbers that parents can call if they want to make an appointment to go get those vaccines at the health department.
Eileen and Hope, can you give again another rundown of which vaccines are required at which age?
Okay, so prior to entry into kindergarten and also into pre-K, there's the entire series that are required for students must be submitted, and that includes polio, diphtheria, pertussis, tetanus combination, depending on the age, hepatitis A, hepatitis B, varicella. Am I missing? Is that?
Measles, mumps, and rubella.
Oh, yes.
Measles,
Measles, mumps, and rubella. Those are for the elementary and pre-K. And then prior to entry into 7th grade, it's the Tdap, which is the tetanus, diphtheria, and pertussis of a different formulation, and the first dose of the meningitis vaccine. And then prior to entry into 12th grade, it's just the dose of the meningitis vaccine. However, there is a caveat there that if the student has received a prior dose of meningitis vaccine before the age of 16, they're required to have a second one prior to entry into 12th grade.
Okay, thank you. So Eileen and Kevin, previously students were enrolled with a 30-day grace period, even if they didn't have all of their immunizations. Is this no longer the case, and will registrars have information regarding this change?
Yes, no, it's no longer the case. We did allow that extension over the last few years because appointments became scarcer during the pandemic. We used to have walk-in clinics at the health department all the time, and then it became appointment only, and it was very difficult for parents to get those appointments before the beginning of the school year. So this year, we're making a concerted effort to make sure we get that information out to everyone, that we will not be allowing that extension. We want everybody to be vaccinated on the first day of school. As Mr. Kurtz mentioned, there are a few exceptions. One of them is when a student is not, student's coming to school for the first time and has not had any vaccines. So the spacing requirements are such that they can't have the entire series all at once. So they have to space them out. So those students can be conditionally enrolled as long as they have one dose of each of the required vaccines and a schedule for the completion of the series at the minimum allowable time intervals.
So I just want to reiterate and clarify, one, this campaign, which this is part of, and we so appreciate the opportunity. This is the grace period. We're like rolling it back. We're taking care of this now. So, but the other part of that question was, hey, when are we at the school going to learn about this? This campaign also includes Eileen and I have produced a video and a written documentation that'll be sent to principals. Following this, we have a superintendent's bulletin, which will then be passed down. So this will be going on in the coming weeks, in addition to communications with principals and nurses that we would like to, of course, would be shared with staff. We've also included Department of Technology on our efforts and the emphasis of the immunization requirements as part of that even electronic registration process. So I just do want to put that out there that, yeah, we're trying to get the message out in all forms with our community, including our internal partners.
All right, thank you. Kevin and Eileen, I think the next one might be for you as well. How much information is being provided to students regarding opioid challenges?
Oh, that's a good question. Well, right now that is part of the health curriculum, the PE and health curriculum in grades. Well, the health and PE curriculum goes from grades K to 12 of 10, excuse me. And that information is provided within the curriculum in middle school and high school grades. We're trying to bring specific programs such as Dr. Chastain's into the school division. So we're working on trying to get that in there for the upcoming school year.
All right, Eileen, Kevin, are there plans for programming for parents and other community members? And how can families and community members request programming or have more information about programming?
Well, we're going to start with going through the parent council, which I understand is a conduit to the individual schools, PTOs, in order to try to schedule some of these programs for parents through that format. And then we'll work with our school administration to try to get some of the programs in for staff and students as well.
That's correct. I'd reiterate, but to be just upfront and out, like there's nothing scheduled today, but we are working with professionals looking ahead to next year, right? We only have like 30 days left of this school year, but to do that in a cooperative way and in a way that right is going to maximize our efforts, whether that's regionally or by schools, looking at parent schedules and opportunities to do that in a thoughtful way.
All right. I think the next one, again, is for Eileen and Kevin, and possibly Hope. Why shouldn't students and parents, et cetera, be able to pick and choose what vaccines they want their child to have?
Ooh, can I take that one?
Sure.
Because the law doesn't allow for pick and choose. That I want to just go back to this. Because it underscores, at least from the school's perspective, it is a public health issue. So critically important that Virginia law prescribes the requirements and even the few exceptions to immunizations. It is that simple. So certainly, Hope, I didn't mean to, and Eileen, didn't mean to cut you off, but I want to underscore, we didn't make this stuff up. This presentation is about the law of the land, implementation, support, and unfortunately, enforcement. And just picking and choosing from a pick list of immunizations, that's not part of the deal.
All right, thank you.
I know that the immunizations and the schedules have been highly researched and have been established to be safe and optimal for best protection.
I will add, because I hear this concern a lot, and I think I understand what's behind it, is there are parents that get concerned about doing multiple vaccines at one time. I can say there has never been any scientific research that says that that is a problem, or that it heightens side effects or long-term effects. These vaccines have been researched for many, many, many years, even before they come to market. They are safe. However, if you want to do alternative schedules and you have the time to do so, that's certainly allowable. Most pediatricians will work with alternative schedules. The health department, we will work with alternative schedules and provide a lot of education about which vaccines should be given at what time, what is the most important, what are the current threats. The basic underlying problem with pick and choose is that even in public health, and even sitting in my office right now, I don't know what's coming down the pike. I don't know, it could be measles, it could be diphtheria. I don't know. These things, things that have been gone for a long time are no longer gone. We have polio outbreaks. It's very difficult to know. So, these are safe and effective vaccines. And the law is based on that reasoning.
Thank you. Dr. Chastain, you presented local opioid data from 2022. Is there any additional data that you have with current information that you could share with our callers?
You're
I
muted.
think you're on mute.
How about that? Okay. We're waiting for the new data to come out. We try to stay on top of it. So that's what we had at this point, but we will be putting out the new data as soon as it's available.
All right, thank you. Let's switch gears for a little bit. Can you consume a pill that has been crushed and tested for fentanyl?
As you mean, can you use it after you test it to see if anything's in it? People do.
Mhm.
People do.
What is fentanyl and why is it being laced into other drugs like marijuana?
Well, fentanyl is an opioid. It's a synthetic opioid, which means it's a man-made opioid. And it's highly addictive and it's just incredibly strong compared to other medications that we have. And I'm sorry, what was the last part of that? Why is it put in?
Yeah, why is it being laced into other drugs like marijuana?
What happens is the dealers want to have the best stuff. And there's a fine line between giving someone like a great high and pushing them over the edge of overdose. But that's why they do it. It's cheap. It's easy to do as far as lace and things like that.
All right. What are the signs and symptoms of opioid use that parents should look for?
You can look for dilated pupils, like the pupils either too big or too small. If somebody is slurring, if they're not able to respond to you at all, because what opioids do is they shut the system down, they slow things down. So your heart rate, your blood pressure, all of that just bottoms out to the point where finally you'll quit breathing. And then your heart will stop beating if it continues. So those are the things to look out for in an active opioid overdose. The good thing about Narcan is if you suspect that somebody could be having an opioid overdose, we encourage people to use the Narcan because it's not going to hurt the person and it can save a life.
Has there been any opioid overdoses in our schools?
That's a good question. I would say that no, we have not had that happen actually in our schools, at least certainly no fatal overdoses in our schools yet. And we're obviously hoping that that never does happen.
The one we talked about were up in Northern Virginia and Culpeper were the most recent.
And I think Dr. Chastain also pointed out that a vast majority of the deaths actually occur at home. Am I correct? Is that?
The vast majority of opioid overdoses occur at home. Yeah. But we feel it's important though to have it at school because it does happen at school, and we've seen that, you know, up in Northern Virginia and things like that. I mean, it does happen. It's happening around the country, and you know, we may be fortunate to date, but that could change quickly. So just to have everybody prepared is so vital and important because it saves lives.
And we do have Narcan available in all of our schools and in several different places within the schools. So we're working hard to try to provide as much of a safety net as we can.
Is it also available in the community, and is it free?
It is. Some places that you can get it free, the Virginia Department of Health have it for free. Region 10, the Community Service Board, and they also do training, Revive training, to do that. You can get it also for purchase at places like Top Notch, Wegmans, Amazon, Walmart, Walgreens, and CVS. Yeah, but Region 10 and the Virginia Department of Health, like I said, you can go there and get it for free.
Eileen and Kevin, I think this one's for you. I'm just wondering about if you didn't get vaccines, because I know it's in the Virginia law that you must get these specific vaccines. Well, what if you don't get the vaccines? In the end, I know you should be getting the vaccines, but what if you just don't? What
So-
happens? What are the consequences?
So let's go with the majority first, right? And then we'll go through, and Eileen, I'm going to need your assistance with my memory. Only because you've studied this so much, you know. So the first is, let's just go, if I don't do the vaccines and I don't use any of there's a couple of exceptions, what's going to happen? You're not coming to school. Like, I'm not going to okay you to walk through the front doors, your children. So now let's just at least know that. It's like, okay, so I know if I'm not covered under any of these exceptions, they're going to enforce the Code of Virginia. Yes, that's our message today. Eileen, if you would, right, is it the big three? There's three exceptions. Let's talk about those.
Okay. Well, and Hope, yeah, feel free to jump in on this. One of the exceptions is exemptions is a medical exemption. That requires a physician notation that the student is exempted from a particular vaccine due to some kind of medical reason. The second one is, well, I guess there's actually four, but one is the catch-up schedule. So if the student is not eligible for all of the required vaccines because of the time interval spacing, then they can come in without the complete series, but they have to complete the series as soon as possible. And then there's also the religious exemption, and that requires a notarized certificate of exemption that the parent can complete. And then the final category is the McKinney-Vento, or families in crisis. So that would include some refugee families and some homeless families. The students are permitted to start school and then work with our federal programs coordinator to get all the vaccines that are required.
Yes. So, and Eileen, if I could clarify on one of the points, because we talked about this previously, the religious exemption is literally a religious exemption. It is not a political exemption or an opinionated exemption or my personal preference exemption. It is a religious exemption recognized by the Code of Virginia. And so I just want to stress that enough, or I can't stress it enough, that it is for religious purposes and it shouldn't be misinterpreted in any other way. Is that correct, Eileen? Hope?
Yes.
Good on that.
Yeah.
Okay.
Some states have a philosophical objection to vaccine, and that's an option for their citizens. However, that is not the case in Virginia. We have only a religious exemption, a medical exemption that needs to be documented, the reaction or the reason, and those are the exemptions provided.
Thank you, Hope.
All right, our next question. The law allows students to be admitted conditionally for up to 90 days, provided they have a schedule for completing the immunizations. And there's a Virginia Code cited 22.1-271.2B. And why is the school division not following that allowance in the law?
Well, it refers to the catch-up schedule. So those are for students who are not eligible yet based on the minimum time interval to have received all the vaccines. That's why they can be admitted as long as they received the first dose with the schedule and file of completion. And it was given 90 days because that is the minimal spacing interval for, was it the hepatitis B shot?
Mhm. Yes. Although the second and third, DTaPs, TDAPs need to be 6 months, but that 90 days provides, opportunity for the series to be completed, but not started. And one thing that's confusing to some parents, and understandably so, is that in early childhood, they will receive DTaP vaccines, which is diphtheria, tetanus, and acellular pertussis. What's required to go into 7th grade is Tdap. Same letters, different order, different configuration, different drug. So while the conditional enrollment, provides that as long as one dose of the series has been given, you can roll them in conditionally. That doesn't apply to Tdap because the child has actually never had a Tdap vaccination. They've only had DTaP, and it's different. So, but it can be confusing. We understand that.
All right, thank you. What are the best ways parents can educate their kids to the dangers of opioid use? What age should we start talking to them about it?
Early. Yeah, very early. I think just finding the moments, once our kids started driving, my husband and I said, we don't know as much of what's going on. You hear so much in the car, maybe something comes on NPR and you take that and like, well, what do you think about that? Or have you talked about that in school? But just to be open and honest, and you can start that, very early. Very early. We see, with a lot of drug use, I mean, we showed some statistics down to 8th grade, and it starts younger than that too. So I think meeting kids where they are at their maturity level and at their grade level and tailoring the message is important. But I would encourage all parents to begin an open dialogue and keep building on that.
Kevin, did you want to add?
I would endorse Dr. Chastain's message. I mean, honestly, even as parents, even little ones, as soon as they can communicate, it's like you never ever take medicine that isn't yours. Just start there at the earliest age, and then you build on appropriately and developmentally. You gauge up. So I fully endorse it as early as a child can learn, and those times that present themselves, those are learning opportunities. So fully, all the way down to, we're not talking about fentanyl with a 4-year-old, but we are talking about safety. And whoa, this orange bottle, that's a no-no. And I'm keeping it up here in this medicine case. You don't go in that. Those are things as parents, I think, are the basis of the discussions later. We build, from the earliest stages on.
And when you have the foundation built, when they're older, they're going to know that they can come to you and discuss these things. Thank you.
All right, we have probably enough time for a couple of more questions. Let's see, aren't childhood vaccine preventable illnesses a thing of the past? Why do we still need to get vaccines for our children?
Well, as Hope discussed, some of these illnesses that we thought were a thing of the past turned out to be a thing of the present now, and we definitely want to try to curb it and get back to the point where these diseases are no longer coming to our country and to our students.
Where can we get the required vaccines for our children, and do we have to pay for them?
Well, there are several places I think we discussed. There's the doctor's office, then there's the some of the local pharmacies, and then there's the health department. And the paying part is a little bit tricky, but Hope, do you want to talk about that for a moment?
Sure. Sure. If you do not have insurance for your child's vaccines are covered under a federal program called the Vaccines for Children program. You will not have to pay any money for your for your vaccines for an uninsured child. If you have insurance and you want to use that insurance, you certainly can. Vaccines that are required to be given to attend public school in the state of Virginia are given at no cost. Your insurance may require a copay, but you're not going to pay for the vaccine. If you come to the health department, that's the same rules with us. So these vaccines are, for the vast majority of people, incur no cost whatsoever. And we do have them available, like I said earlier. If you want to see your physician for those, that's great. I would suggest, because physicians get very busy over the summer, and physicians are human too, and they like to take vacations in the summer with their children. So it can be hard to get appointments, especially we notice a lot of children coming into our clinics that have summer birthdays that are not able to get appointments for physicals because they want to wait until their child's birthday, and that's what their insurance covers, and that makes total sense. But then when they try to get an appointment for July or August, so busy they can't get an appointment. So if you have a child with a summer birthday, call your doctor now and see if you can get an appointment if that's where you choose to get your vaccines. Otherwise, you can come to the health department. You can try a local pharmacy if you have an insured child. Those are options as well.
All right. And this will be our last question for the afternoon. We're close to the end of our time together. I will place in the chat the email address, both in Spanish and English, that you're encouraged to use to forward additional questions. And that's superintendent's office at k12albemarle.org. And our last question goes to Kevin. Are there laws requiring families to divulge a child's personal health information to schools?
To divulge I mean, I'm guessing the theme here versus, hey, we're having a whole nother conversation on FERPA and HIPAA. Like, you mean to divulge immunization records? Yeah, that's the code. So that I'm going to answer it in the context of our presentation. My understanding, and Eileen, look like you want to respond, is yes, part of the enrollment process, the Code of Virginia allows and it endorses the exchange of information with public entities like a public school for enrollment of your child's immunization record. Yes. So I guess so we're trying to read into that possibly. Can I say it's confidential and just have my child enroll? No, you cannot. That is the law of the land. So I hope I hit all facets of that, but Eileen, what do you think?
Well, I was thinking if a student had a medical exemption for immunization, I think the note from the doctor that says the child has a medical exemption does not necessarily have to say why. I think it just can say medical exemption, and they do not have to tell us why. The family doesn't have to divulge that, and the doctor does not have to divulge that. We just have to know that there is a medical exemption.
That makes perfect sense. Thank you for clarifying, Eileen.
But in the context of all other things, that might be a topic for another community conversation.
True.
All right, thank you so much. We've run to the end of our time together this afternoon. Again, you can see that we put the email address superintendent's office at K12 Albemarle in the chat box, so you can send additional questions and or request information. Briefly to close, I'm going to hand it over to Dr. Irizarry However, before doing this, I would like to thank all of our panelists for their time. Lauren Hunt for fielding questions and monitoring the chat. Kenny Wood for our technology support this afternoon. And of course, Dr. Eric Irizarry, who you will hear from last, for managing the slide deck. As I mentioned at the beginning of the session, we have recorded the session and we will send it out to our entire community. The session will be up on our YouTube channel, so you will have access to it. I cannot encourage you enough to email Superintendent's Office at k12albemarle.org email address in the chat. I'm going to put it in the chat one more time. And with that, I'm going to turn it over to Dr. Irizarry, Director of Equity, School, Family, and Community Relations.
No, thank you, Dr. Kaiser. These community information sessions would not be possible without our community partners. We want to work together with our community partners to support our students and our families. So I want to thank everyone for being here today. And in addition to this, we are working with UVA Health and Centura to make sure that our families have resources around not only these topics, but just healthcare in general. We know how difficult it has been out in our community with getting in and getting access to healthcare. So I do want to say thank you. Our community information sessions are topics that are brought to us by our families and staff. So if you have any ideas for community information sessions, please use that same email for suggestions. And on that note, we just want to say thank you and thanks for coming in during your lunch time. And again, thank you to our panelists. We'll see you next time.
All right. Thanks, everyone.
Thank you.
Just helping a few more folks on the way out.
Yeah.
Amelia, thank you so much. Did you have anybody in your room? No. Can you all hear me? No.
Yep, I can hear you.
Oh, sorry. She's in a different room. Let me get everyone out.
All right.
Sorry. Yeah, you're in Spanish. Did you have anybody in your room? You can't see him. Okay. Okay. Yeah, it looked like we had a few. Well, we had about 3 or 4 all Spanish names, so maybe someone was listening to it. So
Yeah.
yeah. Yeah, that was a lot. So thank you so much. That was a lot of dense information, but thank you. Yep. Yeah, I learned a lot. Even the first one, I was like, oh. So, well, thank you so much, Amelia. And I think this might be our last one for the year, but we'll stay in contact.
All right.
All right. Thank you.
Thank you.
You too.
Amelia, I can't hear you. Let's see. Can you hear me? I still can't hear you, though. Let's see. Let's see. Oh, maybe this will. Can you hear me now?
I can hear you. Yeah,
All right. Yeah, I can hear you.
I was just in the Spanish room. So I was just saying that into Kronos, like I punched into community engagement. Did I do it right?